maybe some myths, some old information out there churning under some of the comments. And we invite you today to help us just bust those myths and answer any questions that folks have out there today. So please don't hold back. We ask for the questions. We enjoy them. And then if you do want follow-up information, I'm happy to give that to you. I'm also recording today's session, and we'll be happy to forward that recording to anybody that requests it as well. So with that, I am going to go ahead and hand this over to Dr. Chris Lewis.
All right, thank you, Diane, and good afternoon to everybody. I am Dr. Chris Lewis. I'm the Chief Clinical Officer for Centra Health, and I'm joined today by Michael Elliott, who is our Chief Transformation Officer. And as Diane mentioned, we'll give you an update on our COVID status here at Centra from new information from last week, as well as talk a bit about vaccines. So here at Centra, we do continue to see increasing COVID numbers. As of this morning, we had 45 COVID patients at LGH. This is up from 39 just last time we spoke, which was under a week ago on Tuesday. Of those, we have 30 COVID patients on our floors, as well as 15 in the ICU. Of those 15, a full 14 are on ventilators, which is the vast majority. So last week when we reported ventilated patients, we were at 8, and so that's a significant increase. Another increase we've seen was at Southside, which now is at 9 patients as of this morning with COVID. That's up from 5 last week. And that COVID unit was designed to hold 8 patients, and they've needed to expand now up to 12 with the capacity to go to 16 if they need to. But that does, of course, come at some compromise to being able to care for enough other folks, because they do take beds from general use then. Of note, I do also need to share that we've had a full 8 COVID deaths in the last week since we again met. 2 of those patients were in their 40s, 4 were in their 50s, and 2 in their late 70s. So that was a significant increase in the number of deaths we've seen in quite a while. And also the age trend is on the younger side. So what we have seen, it does continue that we're seeing younger patients. They seem sicker. And we do think that this is continuing to be fueled by the Delta variant. It does stress our system, particularly the critical care capacity. We, over the weekend, came very close to needing to stretch out into one of our regular ICUs to care for COVID ICU level patients. But fortunately, we were able to just avoid that. But it may well be that in the near future, we're going to be moving into additional units. So where this is going is what frankly worries us some. A combination of what appears to be a very aggressive Delta variant, a vaccination rate in our community that is on the lower side from national norms, and also concern for the winter. The winter was not kind to us and many other regions last year with COVID, and the concern is that it could, if we're already where we are in the summer months, winter could be significantly worse. So we then, therefore, again, stress masking, social distancing, and getting vaccinated. We need to hammer that every time we speak with you all because we know it's important. At our facilities, we've also need to tighten our procedures and protocols, and that's why, as of today, our visitation policy is going into effect, which we had talked about last week on this in this forum. I will now turn it over to Michael Elliott to talk about some important vaccination information for our caregivers. Thank you.
Good afternoon, and thank you, Dr. Lewis. For the next couple of minutes, I'm going to discuss what you all have heard of at this point as Centra's COVID vaccine requirement. I'll talk a little bit about the why behind that and what you can expect and our caregivers can expect over the next couple of days, weeks, and months. The first thing is the why behind this. You know, we're here to heal. Before we do anything else, we are here to heal and first do no harm. It has become more and more apparent to us as time has gone on that we have a way to prevent harm and we need to take it. And that's through vaccination of all of our caregivers. This will include volunteers, students, contractors, vendors, and anyone else who comes into our facilities to support our healing efforts every day. So we're first here to make sure that our patients are taken care of and that we heal them and do not harm them. Next, we want to make sure that our caregivers are as protected as they can be as well. And then last but not least, if we're not going to lead in the communities that we serve around this health initiative, who is? So we know all of the things that come along with a decision like this, the good, the bad, and the ugly. But we're here to lead. We're here to take bold steps. And we want to do that in the name of protecting patients. And that's what we've done. So a little bit about what our vaccine requirement looks like. We will require all of our staff, that includes medical staff, volunteers, vendors, contractors, by November the 1st at midnight to have been fully vaccinated and submit proof of that vaccination. Of course, we will have religious and medical exemptions. There's a process for that. And over the next several days and weeks, what we'll be doing is engaging with our caregivers to make sure that they understand the steps in the process, that we answer any questions or concerns that they have, and obviously, and most importantly, to listen as well. We know that there's going to be consternation. We know that there are going to be people who fully support this and others who are fully against it. But that's what leadership is about. Leadership is taking your values, taking your mission, and making sure that you live it out. And that's what we believe we've done here. So with that being said, we will open it up for questions.
Hi, this is Michael with Channel 7. Thanks for coming and doing this here, guys, with us today. I got a few questions. The first one, though, is a clarifying question. You said there's 45 COVID patients at LGH, and I imagine the majority are unvaccinated. Can you give a percentage or an exact number of how many are unvaccinated?
Sure, Michael. Yeah, the vast majority are unvaccinated, and I'll give you the number 4. The vast majority are unvaccinated. We only have 4 that were vaccinated in that whole population. So that's significantly under 10%.
And in terms of this vaccination requirement that you can have for caregivers, last time we talked, you said only 60% of employees were vaccinated. If not many choose to get the vaccine, is there going to be some sort of severance deal? Like, talk about what's going to happen.
Yeah, so on November the 1st, if someone has not submitted documentation that they've been vaccinated, there will be a 2-week suspension process where we will work with those individuals to see if they are going to work through this requirement. If not, this will end in termination of employment.
And I guess, if a significant amount of these people, it's 40% right now that are still not vaccinated, according to last week's numbers, could you guys afford to lose, any big chunk of people if they choose not to get it?
I can tell you, we don't want to lose anyone. But we also know that if we don't take this step, we put our patients at risk. We actually put our own caregivers at risk. As we see this surge go up, we have to make sure that we have caregivers who are here and healthy to take care of people. And so if a large portion of our workforce goes out with COVID, that would impair our ability to care for our patients as well. So obviously, I don't know of any organization that could lose 40% of their overall staff and be able to take care of business. We don't anticipate that number being that large by any means.
All right, thank you.
This is Andre Whitehead with Whitehead Media Ventures. Good evening. How's everybody?
Great.
Good.
There has been a large push, it seems, for different groups, civic groups, church groups, to push vaccinations? Do you have any results in terms of numbers of the minority community who've been trying to get people of color vaccinated?
Yeah, and what I can tell you, Andre, is that it's obviously been slow going here the last several months. Those efforts are still out there. Instead of seeing the, several percentage points increases in vaccination rates that we were seeing several months ago, it's really, hand-to-hand combat now. It's a few people here and it's a few people there. I don't have any exact numbers to share with you, but that's something we can help pull together. I am encouraged by the information that I've heard over the last week and a half or so, which is that as people are understanding the Delta variant, they're seeing these surges happen. U.S. vaccination rates have started to increase some over the last couple of weeks. So I'm encouraged by that. We just need to do way more of that. So I don't have that exact information, but that's something we can look into and perhaps be able to get you some numbers.
And lastly, for me, is there anything that can be said for those who still doubt the science? Again, put out what some call false information. Is there anything that that can be said that maybe you haven't said thus far to talk about the science itself?
So I will say, that's part of what we're going to work on doing internally, but also we'll need to do external facing as well and make this one last push again, almost from the very beginning, to build the case for what these vaccines are, how they were created, how safe they are in the millions and millions of doses that we've rolled out already, and how effective, and what the other side of this is, what now the Delta virus is doing to us. That's what we're going to be doing internally, and I think externally we'll need to work on messaging as well. But it's as you say, this has been going on for a while, and what is left to be said? I think we just continue saying the same things and just pushing the evidence as best we can because it's there.
Thank you.
Hi, this is Madison, donor ABC13. Can you guys hear me?
Yeah.
Great. Thanks so much for doing this today. Just one question and possibly a follow-up. I know fake vaccine cards have become a huge thing right now. People are paying $25 for them, just going on Instagram and things. How will you guys how will you guys work through that, going through when employees submit their vaccine cards, if it's the real deal or not? How will you guys do that?
Yeah, thanks for bringing that up. I will tell you, there really is no way. If someone is going to be dishonest, get one of these cards and fill them out, they will get through the process. There is no way right now to not validate those cards. Now, there are a couple of things on those cards that I've heard of some mistakes in punctuation, spelling, etc. If we find that, we will question it. There's no doubt about it. But frankly, we have over 7,600 caregivers here. We believe in their integrity. We have a great group of caregivers, and I would not expect that to come up. If we find it, we will deal with it, though.
And Madison, I'd add I think we're all aware that there is a central database where all of the true vaccination, if you get vaccinated, the government does track that so that we know how we're doing as a nation. I don't think we're going to be querying that database in any way, but it is really, we're relying on the honesty of individuals and our caregivers to not put themselves and other people's at risk by faking vaccine records. That would be problematic.
Thank you. And then just a follow-up, have you guys heard of any employees, resigning or quitting today after this announcement?
None.
Okay,
Right.
Thank you.
We just announced that we haven't heard of any of that.
Dr. Lewis and Dr. Elliott, could you both kind of take us inside the hospital? What is the general morale of the caregivers, the nurses, the physicians, even you all? Are they tired? Are they frustrated. How are they proceeding with this new Delta variant?
Michael, you want me to start?
Sure.
So I think you've hit a couple of things. I mean, tired, frustrated, very weary. That's, I think, how we're feeling in general. This is now a pandemic that's drawn out for well over a year and a half, and we got through some very dark times in the winter months, and then things got better. And so I think just like the general public, as well as just like you all, there was a hope that, well, now things are better, and now we're seeing this Delta variant and this new resurgence. And so there's a disappointment there, but I think there's also a coming to grips with reality that it's still a fight we have to fight. And our caregivers are resilient. They're ready for it. They're doing it. But I'll be honest, that everybody is tired, but you keep going. And so, part of the vaccine mandate is frankly, we're doing everything we can to make this better. And if you don't require vaccines, we're very worried about what's going to happen in the fall and winter time. And we want to protect our caregivers and protect patients that are coming in. And so, folks are tired. Folks have been through a lot. Our community's been through a lot. But you don't have an option. You just keep going. And that's the spirit, and that's the fight that they have.
Yeah, and thank you, Andre, for asking that question, because at the bottom of all these policies, once we cut through all the chafe, there's real people. And there's patients, there's caregivers, there's extended families, and everyone is in a different place. I can tell you, around quite a bit in our facilities, we have caregivers who are saying, what are you waiting for? We need to mandate this vaccine. People are dying. If I have to hold the hand of another patient who's dying without their family around, or call extended family to let them know that a loved one is not going to make it, people having remorse that they did not take the pandemic more seriously or did not get the vaccine. There are others who might be on the other end of the spectrum. They're tired. They're working just as hard as anyone else, but they might say, my body, my choice. And so this is one of the reasons I respect our caregivers. They come in every day, every night, and they take care of our community. Now, when it comes down to a vaccine mandate, we may end up on different sides of this argument, but that will not change the fact that we'll be here every day and every night to take care of whomever is in our employ.
Hey guys,
this is Leanna Scacchetti with WDBJ7. Can you hear me?
Yep. Yeah.
My question is, I know that recently the governor announced a vaccine mandate for state employees, but said that if they chose not to show proof of vaccination, then they would undergo weekly testing. Did you all consider that as an option when coming up with the mandate for your employees, the alternative to weekly testing if they didn't get vaccinated?
Yes, we've considered really the universe of options here. We've consulted locally, regionally, at the state level. We've consulted with individuals and organizations around the country. And at the end of the day, it is a good step to do that weekly testing, but that still puts patients and other caregivers at harm. And so we wanted to take the step, frankly, because we see some things that are coming in short term and long term. We believe that it's imminent, that we will have full FDA approval within the next several weeks. We also believe that it's imminent that we're in for a rough couple of months with the Delta variant. We also know that it's imminent that most, if not all, health systems and healthcare providers, much like the flu vaccine, will end up requiring the COVID vaccine as well. So if you really play this out over the next 3 to 6 to 9 to 12 months, all of those things will come to fruition.
Dr. Elliott, Andre again. Diane opened the press briefing by asking us with the press not to hold back. As you may have heard, there are people who have made public posts, told their story about getting COVID, the virus, for a second time or even after being vaccinated. There are those on social media who take those stories to say, hey, this is proof that this quote unquote great vaccine does not work. Could you all respond to those who may have that view?
Michael, do you want me to start with it?
That'd be great.
That's an excellent question. Thank you for bringing that up. Yes, it is the case. We do know, and we've known, that folks who've been infected with COVID can get infected again at some point. Fortunately, it does not seem to be very frequent. It seems to be a very unusual thing, but it is seen. More importantly is, frankly, your second piece about folks being vaccinated and still getting the COVID virus. And that has been maybe a bit of a misunderstanding. From the very beginning, it was known that the vaccine was not perfect. There is no vaccine that is perfect. The percentage of people who are protected by it, the protection rate is extremely high, but it is not 100%. And so we knew that some folks would be infected with the virus even after getting vaccinated. So, and that we saw that in the trials. And so that's not a surprise. But what also has to be really emphasized is that we also know that folks don't get nearly as sick if they get infected after being vaccinated. The rates of hospitalization of those folks, or the likelihood that you will need to go to the hospital because you get infected after vaccination, is much, much lower than if you hadn't been vaccinated. And the same thing goes for death, frankly. It's extremely unusual for somebody that's been vaccinated to die of COVID. And so all of these reasons, it's not correct to say, well, because the vaccine is imperfect, it's a worthless vaccine. That is just simply not right. It's an extremely good and useful vaccine, but it's not perfect. And we knew that. And so, but still, the benefits of getting this vaccine clearly outweigh any risks of mild side effects that some folks get, or extremely unusual, more serious vaccine consequences. It's just, we've seen it for months and months now, over millions of vaccines. And that's why we're feeling very comfortable saying this is the right thing to do to protect our patients and our caregivers and urge the vaccination.
This is
Good afternoon.
Fred L. from
This
Radio
is Tanner
IQ.
Evans.
I guess.
You go first.
I just wanted to make sure that I'm understanding when you use the term caregivers, is that all patient facing employees? Are we talking about all employees, maintenance, administrative, et cetera?
Yes. When we say caregivers, that's everyone who works with us here at Centra Health. Little known to folks, we mostly think about doctors and nurses because they're so visible. But there are people all over this organization, in front of patients, behind the scenes, making sure that things go well so that we can care for one another. But we don't just care for patients, we care for their families while they're here. And frankly, we care for one another. I think we've all worked in work environments where having a good crew around you can make it a very pleasant and effective thing. And if you don't, then it's not. All those things go into have a healthy working place. So that would be all 7,600 of our employees. We call them caregivers because that's what they do.
Thank you.
You're welcome.
Tanner, do you want to go?
Yes, I would love to. Thank you. I want to dive into the numbers just a little bit because social media really wants to pick those apart right now. Of the 4 patients that were vaccinated who are currently in the hospital, are they in the ICU or are they just on the COVID unit?
Danner, so it gets sort of a little bit challenging because I can't, if I get too specific, then you can start potentially identifying patients and who's been vaccinated or not. I can tell you that either the vast majority or all of those patients that were vaccinated are not in the ICU, that they are out on the floor. Is that good enough?
Well, probably not, but you can only do what you can do. And I wanted to further dive into that a little bit. Of those that are in the ICU or on vents, did any of them have like long-term care issues that they were dealing with already, or is this just a part of COVID? That's another question people have.
Right. So you're asking about comorbidities, and Dan, frankly, it's a mix. I mean, some of them clearly will have some comorbidities like diabetes and hypertension, that sort of thing. But we're also seeing folks who really aren't having that sort of thing. We've had somebody, and again, I can't be too specific and give patient information away, but we've had otherwise fairly healthy folks in the 40s and 50s who really are, up and around and normal, functional folks who really got very, very sick and ended up in the ICU. So it's a mix. I mean, clearly some of them will have comorbidities, but there's some that really, they're looking a bit different than they did last time around, where most everybody really had multiple comorbidities and were older.
What can you tell me of the 8 deaths in the last week? Were those patients vaccinated? Can you give me any information on that?
Dan, are you getting, I can tell you again, the vast majority were not vaccinated. But if I can't give you too much information because that then starts getting into personal things for identifying individuals.
Okay, I certainly understand that. I wanted to talk a little bit about your ICU, if you give me a chance for a second. Now, at what point did you have the highest number of COVID patients that were hospitalized in the ICU? Do you remember that back about when that time was and how many beds it was and how what you're seeing right now compares to that?
Oh, Tanner. I mean, I remember the total number is 133, and that was back in January, around January 12th or so. In terms of ICU, we had spilled out over the VAU, so that was 18 positives, 18 beds, and into the STICU. So we were getting, I mean, I'll have to go back through the records, but well over into the high teens, potentially even 20s.
So really, you're headed back in that direction again.
We are, and unfortunately, this is it's concerning. We can stay right now in the VAU, that 18-bed unit, but once you start spreading further, then you're taking ICU beds away from other critically ill patients. People come in with trauma, people after significant surgeries, and that's when things get more and more difficult.
Okay, so to be clear, there's 18 COVID ICU beds.
There could, yes, 18 potential COVID ICU beds. Once we outstrip that, then we're moving into other ICUs that are, regular ICUs.
Okay, I was hoping maybe, but one last question, I promise. Have there been any pediatric patients admitted to the hospital that you know of?
We have, and again, I'm going to have to be fairly de-identified, but as of last week, we had a very young teenage woman, girl, and fortunately she did okay and was able to leave again. And we've had an individual in their higher teens, but we are seeing younger folk that need to be admitted. Fortunately, nobody's done terribly poorly so far, but they've been sick enough to need to come to the hospital. And we're hearing, I will tell you.
Thank you so much.
Sure, Danner. So we're hearing from our community pediatricians that they are seeing some sick kids as well testing positive with COVID, that they have some concerns that they may need to end up in the hospital. So we're getting that more as a heads up for our information.
Well, to that, have you been talking with the school systems about concerns with, I mean, I know that they are to be masked, but is there a conversation going on with the school system?
Michael, do you want to take that with our weekly calls?
Sure. We work for the greater Lynchburg area. I'll go there first and then talk about Centra Southside. So for the greater Lynchburg area, we've worked with the Lynchburg Regional Business Alliance, and for probably 6, maybe 7 months now, we've been holding at varying intervals meetings with our leaders of higher education. So that would be K through 12, public and private leaders, as well as area colleges and universities. Right now, we're meeting weekly, and we go over what's the latest positivity rates, what's going on from an inpatient standpoint at Centra, and we have conversation about what steps might look like, what recommendations might look like moving forward. And so, yes, we're deeply engaged right now on a weekly basis. And of course, things happen offline outside of meetings as well. Our Centra Southside Community Hospital does the same thing at varying intervals as well. They've pulled a good swath of the community, not just their educators together, but those in public administration. They're there as well. And so we certainly are here to engage and make sure the cross-sector of our communities are getting the most up-to-date information. And lastly, I will say our Department of Health is involved in all of those conversations as well.
Hey guys, Courtney Lockheed here with WSLS. We have a question from some viewers wondering if you guys could answer it. For those who got the J&J vaccine, it seems that there isn't an option to get a booster shot. We've just been hearing it about Pfizer and Moderna. Is there any recommendations to those people? I know that like some places in California are offering like supplemental Pfizer or Moderna shots to those people, but it's not in line with CDC guidance. I mean, what would you tell those immunocompromised people?
So to be clear, if they are immunocompromised and they got the J&J, they should also be eligible for a booster vaccine. And that's something they should definitely talk to the healthcare provider about. But J&J, just like the other two, now they may well not get the exact same. They may not get J&J once again, but they should be able to cross over to one of the other mRNA Pfizer or Moderna vaccines. So they should definitely look into that. And this is all new, fresh off the press as of end of last week that the FDA as well as CDC recommended these boosters. But it's across the board for not just the Pfizer and Moderna, but also J&J.
Dr. Elliott, with so much money coming down to the Commonwealth from the federal government, God forbid some of your employees decide to leave Centra versus getting the vaccine. Are there any funds available whereby you could provide incentives to get more people to join the team? And then on sidebar, if that money or if there are funds available, are you giving bonuses to folks who've stayed and worked those long hours, who've suffered and endured to care for the sick?
Yes, Andre, I'm not aware of any dollars coming from the states or federally for that specific reason of recruitment and retention. But I can tell you we are actively looking at ways to keep and retain our staff as well as entice others. I'm not at liberty to discuss that at this point as it is in development still, but we are certainly looking at that.
Yeah, and Andre, I'd tag on that, this move was fully endorsed unanimously by the Centra board, by Centra senior leadership, by the medical executive committees, which is the physician leadership of all three of our hospitals. And when the board endorses this sort of thing, it was seen as the right thing to do. And whatever financial consequences, whatever we have to do, we will make it work. And if that's paying differently, paying more, they're aware of those potential consequences. I don't know that we'll look to the outside for help, but we internally have committed that this is the thing we need to do to keep our patients safe and our caregivers safe. So whatever the financial implications are, we're going to see it through.
And of course, the personalities of your staff. For those in the community who read the information that we shared directly from you about this vaccine requirement, do you have a sense? Do you know the pulse, the general view of your staff, for those who may be concerned about people saying, I will not take the vaccine, I am going to leave my job?
Yes, our role here is to listen, to engage, and make sure everyone feels as if they have an open opportunity to not only ask questions, but express their concerns as well. So what I would ask is that even though we're going to have people that have much different ideas about this requirement, let's give everybody some grace. So if we give grace, grace will be given to us as well. And I would love for this to be a situation where everyone was excited about this being the requirement and thinking this was the best move. We know that's not realistic, but we don't care for those caregivers any less. As a matter of fact, they've been here toiling just like everyone else. So we're going to show some grace and empathy, and hopefully we can retain as many individuals as possible.
This is Leanna again with WDBJ7. And just again, for context, I believe you had mentioned a flu vaccine. But my first question is, for people who come to work for Centra, have there already been other kind of vaccine mandates in place that they have to come to the workplace with? And then a second unrelated question, talking about the spread of COVID within the community. Is there anything that you can say about the status of COVID in long-term healthcare facilities at this point?
Michael, you want to do the first? I'll do the second.
Sure. And the first question was, once again?
Mandating vaccines, as in flu vaccine.
Oh, yes, absolutely. So I've mentioned the flu vaccine a couple of times now because little known to many folks is there is a flu vaccine requirement that has been in place for a number of years for the same reason why we are putting the COVID vaccine requirement in place. No patient should have to come to one of our facilities and worry about being harmed. And so if we can prevent, from an infectious disease standpoint, potentially passing on any type of virus, then we should do so. We feel like that's the core of why we're here as a healthcare organization. So flu vaccine has been required for a number of years. And so this is following very closely that policy.
And Leanna, to your second question, it's actually a very good and important one. And I'm pretty sure you've been covering this thing from the beginning. If you'll remember, last time around when we started having this type of situation in 2020, when there was community spread of COVID like this, it was the long-term care facilities that were really being just decimated by COVID. It was running rampant through them. They had to shut them down to admissions. And frankly, we were seeing a lot of those patients. Those are a good percentage of our patients coming into the hospital sick. They were certainly the elderly, the more vulnerable, and they were the ones who were really getting hurt with COVID badly. This time around, it's interestingly very different. That we are seeing COVID small outbreaks in these facilities, and they seem to frankly be mainly with the caregivers, the workers that are there. Some of them are vaccinated, but the majority, again, unvaccinated, but they're the ones who are testing positive. And at times, we are seeing some residents also testing positive. Again, the nice thing is that the majority of them now generally are vaccinated. So even those that are testing positive are having mild or not very significant symptoms, or frankly, are just asymptomatic. And the key is that we're not seeing them flood into our hospital like they did last time. And so that, if there's any good news here, it's the fact that we're not getting overrun by nursing home residents like we did before. We're mainly seeing community folks, which is different. And so if you want to point to a success story for vaccination and high rates of vaccination, which frankly our long-term care facilities are seeing much better than in our community, it's this example here. It's great. It's good to see.
Regarding the consideration of religious exemptions or medical exemptions, I imagine there's the potential for quite a number of people to come forward claiming those. Who's kind of in charge of determining that, and can you give any insight as to what kind of criteria you guys are looking at when considering those options?
Sure. From a religious exemption standpoint, once again, through even our flu vaccine requirement that we've had in place for a number of years, those religious exemptions run through a process through our human resources department, where that is looked at, and the caregiver that is seeking that exemption fills out a form, goes into detail about those seriously held convictions, and that's reviewed. From a medical exemptions standpoint, that usually looks at some of the things that you've heard that are already issues that are looked for when someone is being vaccinated. So have they had a reaction to any of the components of the vaccine? Or is there something else that's going on with them clinically that does not make this a good time for them to receive the vaccine? So that is going to be reviewed through our employee care program. And we have a medical director of that program who will be the ultimate decision maker there. And so we have those processes set up, frankly, because we've had to do it with the flu before, and now we're adding on COVID vaccine to those.
Perfect. Thank you so much.
You're welcome.
Is there any upcoming plan to, get out the vaccines even more? We know that they're in a lot of the CVS's and the Walgreens, if you will, but is Centra working on any kind of new plan, or is it a situation where the vaccines are readily available all over the place?
The latter, Andre. The vaccines really are available all over our communities. But what we are doing for our caregivers, we will be ramping up some clinics internally. Now that this requirement is out there, we'll start that during the month of September so that they can have even easier access while they're at work to the vaccine. But you are 100% right. Access to the vaccine is no longer an issue.
Thank you. Are we missing anything, Dr. Lewis? Are we missing anything as journalists trying to get these stories told and these messages out? Help us. What are we missing?
Oh, goodness. I mean, I think you're doing a great job. I think the job we all are doing is not easy. It's trying to spread as much accurate, true information, really trying to come from a place of we want to take care of folks. We want to take care of this community. This is often, it gets talked about in political ways. This is not for us. It is not a political thing in any which way, shape, or form. We just want to take care of people. That's what we're here for. And so any way you all can spread that message, we rely on you heavily. We really thank you for what you've done so far. It's not easy. And then we have to see how it's received. And we know the message will be received many different ways. We just try our best, and I think you do as well. So thank you for coming and spending this time with us, and then turning around and doing what you're here to do is to inform folks and let them know what's going on out there, and frankly, let them know what's going on inside their hospital, because this is their place. This is for them. If you're sick, we're here for you. We would love for you not to get sick. And if there's a way to prevent it, as in vaccination, we would do anything we could to try and make you feel comfortable with taking it, because it makes a world of difference.
Thank you.
Thank you all. All right.
Thank you all.
Okay. Appreciate you all very much. Thank you.
Take care. We'll talk soon.
Thanks, everyone.
Y'all be safe.
Thank you.